I have a younger sister with cerebral palsy, so I was exposed to medicine and hospitals and doctors from a very young age. And I knew through my growing up with her that I wanted to have the same impact on patients and people that my sister's doctors had on her. Hi, my name is Kimberly Stevenson, and I'm an orthopedic surgeon here at Penn Medicine. I am an adult reconstruction specialist, so that's a joint replacement specialist, so I mainly do hip and knee replacements. I do primaries, meaning first-time surgeries. I also do revisions. A revision is typically a hip or knee replacement that was done for the same indication, but is still having an issue or having a new issue. I'll see a broad variety of ailments. I'll see someone who's had pain for a week, so they'll come into me, they've tweaked their knee playing pickleball, and we find out they either have a degenerative meniscal tear, an acute meniscal tear at times. Sometimes that's also in the setting of arthritis, so I'll see a lot of acute injuries and then we find out that there's underlying arthritis and that may change our treatment pathway. I'll also see patients who have had pain for 10 plus years, who have failed every single treatment option available to them and are now seeking definitive management in the form of surgery. So I can see people at any point in the spectrum. I think it's important for patients to know that although I'm a surgeon and I love to operate, I'm a very conservative surgeon. I believe that joint replacement surgery should be a last resort. I want surgery to work for my patients. I have very strict indications for surgery, and I think that helps my patients do well from surgery because we're choosing the right surgery for the right patient. A goal for a professional athlete is to be getting back to their sport. But for my patients who are largely an older population, their goals are to walk without a cane or to be able to golf again. And so those are the goals of joint replacement surgery: decrease pain, increase mobility, increase function. Ultimately, the goal is the same, get them back to doing what they want to do, but it's a different goal for them. The best part of my job is making an impact on patients' lives for the better. I believe that joint replacement surgery helps improve patients' quality of life and improves their function, gives them the ability to feel like themselves again. And when I see that in the postoperative period at different time points, it's just incredible to know that I had a piece in that. It makes me want to keep doing it, want to keep improving, and make it even better for patients.